Hello, good afternoon to everyone. Welcome to the NORDIC Health Amplified Nurse Program. So we are on to our second presentation today. Earlier today, we actually have an in chat. If you have missed it, not to worry, we have it recorded. So just email to me and I'll share with you the presentation. And now we have Aalto, who will be presenting, and Aalto will be the one presenting today. And at 5 p.m. we have ESCOM. So the session tomorrow will be 4 p.m. Only one session today. Tomorrow there's the last one from Octavo. And presentation structure will be 30 minutes of presentation and demonstration, followed by 15 minutes of Q&A. So we have been presenting since the 7th of June up to 15. Everything's are recorded. Just email to me and I can send recordings. If there are any challenges that we are facing that we have not covered, please email to me as well, so I can be on a constant lookout for you. So my name is Nika from Innovation Norway, and my mobile number and email is here. So a total of 17 companies are presenting. So these are the first 8, and these are the remaining. So without further ado, let me introduce Aalto. Aalto will be presenting. I'll stop sharing now, and Aalto can take over.
Yes, thank you.
I will share.
A bit soft.
It's again soft.
Yes. Yeah, now it's okay. It's good.
Okay. Now. Okay. Let's hope it stays good. All right.
Okay. Go ahead.
I will just opening my screen and can you see it now?
Yes. All good.
Okay. Excellent. So hello to everybody, or good afternoon for you. And my name is Outi Merilahti, and together with me, Ramya Gaurisankar will be presenting our concept for you. So let me see there. So for today, I'll first introduce briefly Aalto University and then our pressure ulcer prevention concept. And then I'll highlight some collaboration possibilities that we could have, and then we can discuss a bit further. I'm not sure it's going to take 30 minutes to present, but then we'll have more time to discuss. So first, quickly about Aalto University. Aalto University is not very old, a little over a decade, but it's a combination of 3 different universities located in the capital area of Finland in Helsinki. So Helsinki University of Technology, and then University of Art and Design, and School of Economics. So it combines 3 different disciplines into one university. And it's one of the most well-known and best universities in Finland, and also one of the larger ones, with 12,000 students and 4,000 staff. The key research areas at the university are presented in this slide, but I would just like to highlight that health and well-being is one of the key research areas of the university. And there are several different departments working on various topics within health and well-being, combining all the 3 aspects of the university quite often, so business and design and technology. Also, the university supports entrepreneurship and the formation of new companies, which is one of the reasons we have this project ongoing. So the aim is to build a product for the healthcare market, and the university supports this aim. So let's now move quickly to our project or concept. So the no-sore pressure ulcer prevention concept is a very early stage project still at Aalto University. So we don't have a demo for you today at this stage. Basically, the concept is based on the risk factors of pressure ulcers. So not just pressure, but also the shear and humidity and temperature. We're trying to take those into account as well. Oops, that went really quickly. Our core team is combined from different professionals from different fields. So we have a nurse in the team, as well as Ramya here with us today. She's an expert on textile-based sensors. My background is in business. We have Emmy, who's an expert in wearable materials and design, And then we have Professors Yu and Buyaklia, who are specialized in software, algorithms, and electronics. So we have a very competent team behind this project. Now I'll explain to you how we've designed the functionality of the product. So an example of a patient that's been in the same position for some hours and maybe developing at that point the risk of pressure ulcer, let's say in the heel area, if they just lie still on a bed. And that could be the outcome. Now, if they're using the NoSOR concept, it's a textile-based smart sheet that comes on top of the bed and has some sensors in it that will assess the risk of pressure injury on the bed. So different spots can be monitored at the same time. Not just the heel, the sacrum area or the back or the head could also be monitored. And when the risk gets too high, the system gives an alarm to either a standalone screen or something that's combined to the hospital systems, where the caregiver can see not just the risk in different areas of the body, but also instructions on how to position the patient so that the risk gets reduced. And then the caregiver can then reposition the patient. Of course, this brings benefits to not just the patient with the improved quality of life and less pressure ulcers, but of course also to the nurses when they don't need to remember to turn the patient, for instance, and they'll get instructions on how the best reposition the patient. So even more novice users could benefit of this solution. And the benefits to the facilities would be cost reduction and shorter stays in the hospital, and to the general society with the improved cost efficiency of the healthcare system. Now, a few words about how we could collaborate. So as I said a little earlier, this is still an early stage project. So we're definitely looking for opportunities to collaborate in the development. And we'd like to understand what the global needs in pressure ulcer prevention are. So we've, of course, talked to local healthcare units here in Finland, but we would really like some feedback from elsewhere as well. And as we are early stage, we can still consider changes to the product. And therefore, we'd like to understand your perspectives of what you consider most important things in pressure ulcer prevention. And a final highlight is that coincidentally, one of our team members, Professor Ivan Buyaklia, is actually visiting Singapore starting today. So he's there due to another collaboration between Finland and Singapore at the SUTD University for 1 month. So in case any of you would like to meet with him, that can be arranged at that time. So he has a very long academic track record, but also experience from the businesses that have been creating medical products. Okay, short and sweet. So we're in the questions section. I'm sure you'll have questions and we can go into those first, and then we'll have some questions as well, if it's possible to ask those.
Thank you. Yeah. So now we're open for questions from the floor. If there anybody can just unmute themselves, or you can also type it into the chat box. I wonder any of our nurses here. I think all the nurses are very familiar with kind of pressure ulcers issues. So anybody want to share?
Hi, Manfred here. Actually, more
Manfred,
yeah, asking about more like at what stage of development is it at? I understand you mentioned it's early stage, but how far do you think like this product can be ready for at least a phase 1 test?
Yeah, I think earlier you mentioned about fabric sensor, right? That's quite interesting material.
Yeah, I think earliest next year. So not this year, for sure. But Ramya, if you have any comments on this, you can definitely speak as well.
Yeah, so we are right now in early stage of testing different materials to see and different ways of integrating different kinds of textile sensors in the smart bed cover. And we are hoping to have, like Oti said, a testable prototype by the end of this year or early next year. So that's the goal. And of course, understanding different kinds of markets also helps in the kind of features or things that we can actually incorporate into the technological development at an early stage. So it's also would be an interesting insight from your side in that sense as well.
Thank you.
Does that answer your question?
Yeah, it does. Thanks. Do you foresee the sensors posing any additional risk to the patient?
So we are hoping to, of course, these sensors are going to be extremely thin or layered within the under layers. So shouldn't be any threat to the patients. There will be no additional texture or material poking into the skin, of course, that we have to take care of, and other kinds of course, also we are working towards having a completely insulated layer, so there would be no contact to the skin or any other liquids or anything else that comes in contact with the top of the bed. So on top of that, of course, there would be additional tests and other kinds of safety regulations would be, of course, need to be followed on top of that when it comes to that stage of testing.
So just a question, when you all mention possibilities for collaboration, like what kind of collaboration are you looking for? I know you mentioned like what is important to you, but like more specifically, what kind of collaboration, like in terms of product development or mainly just feedback, use case testing, or more like a survey?
We'd be open to any pretty much, but we were thinking, or our thoughts would be in getting some feedback for the concept. That would be the first step. And later on, maybe then any type of testing that would be possible would be very interesting for us.
So like, are you considering integration with other types of patient monitoring devices as well as to have a one-stop platform, or you're looking at having this as a standalone?
At this point, we've been looking at this as a standalone, but to ask you about that, do you have thoughts about what kind of other elements would be relevant here?
Usually, in most cases, when we talk about like patient monitoring and stuff, usually they have things like blood pressure, vital signs, those basic kind of information.
Yes, so integrating all of them in the same.
Yeah,
so we have discussed that, but at this point there's no plan for that. It's from the technical perspective, at least some vital signs could be possible to integrate into this type of a textile-based solution. But at this point, I think it's a bit too early to think that we could add that much more into this product, but it could be a step in the later phase, yes.
Yeah, thank you. Generally, I think it's quite a good idea to have this smart bed sheets.
Yeah, so actually you mentioned textile and Manfred also mentioned bed sheet, but Ramya, you mentioned that there's no contact with the patient. So maybe you can clarify as actually where do you put this textile so-called? Is it under the bed sheet, under the mattress? And if it's not going to have contact with the patient, why a textile? Then it should be a more robust, more a more rigid sensor so that you can clean it easily. Textile generally in the hospital, generally fabric highly contagious, so it need to be washed. Normally you put it through high temperature washing, and it is actually going to be crushed with other bed sheet as well. So that could be quite challenging for building a sensor in the textile.
Yeah, that's a really good point. Actually, we were also thinking a lot about that. And we finally came to, we decided that because usually the hospital mattresses have some kind of like a rubbery, water resistant
mattress
cover
protector
of the mattress cover. So we were actually looking that maybe that would be a good place for like a good form for our sensors to take, because then it can be under the layers of the bed sheets that need to be cleaned more regularly. And usually these mattress covers are wiped clean with disinfectants. So then it would kind of follow the same kind of practice. So there would be no real need to change the cleaning procedures with this integration. And apart from that, since we are testing, we are looking for pressure sensing and some other parameters. It's also helps us to be as close to the body as possible. So top of the mattress is probably the best place for it. If we go under the mattress, then also it's a bit more challenging to get the kind of information we need. So we want to be as close to the body as possible, but still keep enough distance so there can be that it is safe and easy to use in everyday situations, and it doesn't take too much time out of nurses' everyday schedules to clean, or doesn't change their practice too much. So that was the
so how will you say that yours differ from the existing? We have those pressure mat which we place under patient. Those are used to sometimes used to evaluate those kind of turning mattress products, where you used to measure the pressure at different point of the body in order to understand the effectiveness of the solution. And some hospitals will use pressure mat to detect patient exit from the bed, patient sitting up, or patient lying at a different position. Yeah, so how does your product differ from a standard pressure mat?
Yeah, so there are two things. One is that as the NoSor is a whole system, not just the mat. So we are hoping to have some kind of uniqueness in the service we provide. So it's not only the information from the pressure mat, but we also want to, there are other parameters that influence the pressure injury, for example, moisture or temperature. So we want to also have a more holistic understanding of the patient lying on the bed through this system. But also there is the aspect the software that analyzes this information and maybe guides the nurses to also to suggest the next positions, keeping in mind the history of the different postures over time. So it's not only saying that there is pressure here, please change, but it's smarter than that. It knows where the risk areas are over time, and at least that's the kind of system we are starting with. And this is why also we are seeking your advice and feedback. If you feel that this is from your context, if you feel like it should have something else, or that we could consider some other aspects that we are missing, it would be helpful to hear from you as well.
Hi, Caroline here from NUH. I just want to ask, so basically this system is like what Nika mentioned, that it's more like a mat and then plus a software portion which will detect all the potential factors that will cause bed sore. Am I right to say that?
Yeah.
Okay. So is there any so is there any intervention that will be suggested, or anything that is being done to do the to relieve the pressure? Yeah.
Any functionality that automatically
Yes.
helps with the
Yes.
Currently not in our system. So the only thing that there is that the software will show and help the nurse or caregiver how to reposition the patient, but it doesn't do anything automatically at this point. And this is actually one of the questions we were thinking of, since we did see in your request that this automated turning functionality was something that you were looking after, and then we have seen a couple of solutions entering the market that have at least something like that. So can you tell us if you've tried any of these solutions, and what's your experience been with them?
Well, I think we did see quite a number of products. We have see the demos. For us to try, I think we are not that. I mean, we have tried demo, and the nurses have lied on it, and to have a try themselves. So on patient wise, we did not go into a trial. Because we felt that it was not convincing enough for the nurses to go into the trial yet. Yeah, so that is, I think that's one of the pain points that we wanted to ask whether Aalto actually can do that.
Yes,
yeah.
But that's something that's important for you, the automated turning functionality.
Nurses have to spend time to turn all the patients that requires skin care. Yeah, put it that way. So I think in a ward it can take quite a long time. It can be up to like quite a number of patients that need turning, and the nurses will be going around to do that. Yeah. So if there's a system that actually can detect the possibility of causing pressure sores, pressure ulcers, and have the functionality of relieving the pressure places, that is more of what we're looking at.
Can you give us any examples of the products that you tested among, you said you tested within the nursing community, not with patients, but can you tell us which ones you've tested and why you were not happy with them?
Okay, so I think there were a few concerns. We have tried Toto. I'm not sure whether you have heard of it. It's a Toto turning mattress. Yeah, so most of the product that we tried is actually alternating palmed sides, where it helped to elevate the patients on one side to the other side. One of the concerns that we have is that, yes, it does elevate the patients, but it depends on the weight of the patient. It will, the amount of pressure that you, how to put it? So the amount of pressure that is leaning on one side, it's dependent on the patient's weight as well.
Right. Okay.
Yeah, because in your mattress, even though they lift it up, so how much it can, although they say that it can be like 30 degrees or 45 degrees, but without the patient lying there, yes, definitely they probably will be able to lift 30 degrees and 45 degrees. But with the patient weight, we find that the tilt is not as much.
Okay.
Yeah, so the relieving part, I think for the nurses, they don't felt as they are not as successful as what they claim to be. I mean, for the nurses, like in their view, yeah.
Okay. So they still have to go and turn the patients themselves?
Yes.
Okay, thanks. That's very helpful information to us as well.
Okay, thank you.
But do you think that a notification system would be something you would consider, or is it really about the automating is what you place more importance to?
I think for us, we are really looking more for the automation. For usually the nurses will have a routine to turn the patients. So we are trying to reduce that round to turn the patients if it can be automated. For detection, I think it's a good to have, but it might not be a must. Yeah.
Okay, thank you.
Thank you.
Okay, so if there are no more questions, I think it's possible that I think we already covered our questions pretty much as well, but if there are any more comments to these questions, like what are you currently doing with pressure ulcer prevention, mentioning any of the devices or technologies you tried, and we just discussed the last one about the risk analysis versus turning, where the turning is really what you're looking after. Any comments are really very, very welcome at this point.
So thank you, Aalto. Maybe what I suggest is that if any of the audience have any questions, or you have any questions that you want to ask, then we can email to me. Then I can see how I can do the connection to get the answers. Would that be better? Right? Okay.
Yes, that's absolutely fine as well. Yes, that suits us definitely. So, and if anything comes to your minds later on, then just contact Nicker.
So if you want to keep the audience updated on the progress of your research, you can also email to me. Then I can.
Yes, that would be excellent. We will do that.
Yeah. Okay. So thanks, Aalto, for the presentation. Thanks, Ramya, as well. So our next session is tomorrow. Our next session at 5 p.m. There's a ESCOM coming up, but tomorrow there's another one 4 p.m. with Ortivo. So please join me in the next session as well. So hope to see you guys soon as well. Thank you. Bye.
Thank you everybody for joining.